Hey everybody, my name is Dr. Scott Giacomucci. I'm a trauma therapist and educator in Pennsylvania here. And today I wanted to talk a bit about the ways that trauma can really impact sleep. This is another topic that I feel like probably doesn't get talked about enough, and it came up in one of my trauma therapy groups. So I thought it might be useful to make a video about it. So disruptions to sleep and sleeping patterns are pretty common in the aftermath of trauma or for anyone that's experiencing traumatic stress of any kind. Trauma can really lead to even insomnia or sleeping disorders. And it makes sense if we think about it. If trauma leaves us feeling unsafe in the world, in our neighborhoods, in our bodies, in our own homes, it makes sense that if we're feeling unsafe, it's going to be harder to get to sleep or stay asleep. One of the most common ways that trauma can impact us is it can really leave our nervous system on edge. And if our nervous system is on edge and we're experiencing hyperarousal and hypervigilance, our nervous system is overactive, and it's going to be hard to calm our body down enough so that we can really go to sleep in the first place or stay asleep long enough to feel rested. For many people, being in the dark can be activating or triggering. This came up in one of my groups a couple weeks ago. Some of the clients I was working with were really feeling embarrassed and ashamed to share that being in a dark room activates some of their traumatic memories that involved being in a dark room. Or even for someone that's experienced trauma that took place in a bed or a bedroom, trying to sleep in a bed or a bedroom could be a reminder of the past trauma. And so it makes sense that trauma could really impact sleep. To complicate it even further, one of the most common symptoms of PTSD is related to flashbacks and nightmares. And so if we're constantly having nightmares while we're sleeping, it's likely that these nightmares are going to wake us up in the middle of the night and wake us up really activated and anxious and hyper-aroused, which is going to make it harder to go back to sleep. And if the nightmares are really severe, we might start to become afraid of going to sleep in the first place. And then we don't want to go to sleep because we're afraid we're going to have that horrible nightmare again. And this can kind of just create a cycle of fear related to sleep. So many people with PTSD or who have experienced trauma have a really mixed relationship with sleep because of these nightmares. Now, I like to really challenge or reframe nightmares, even though they're painful and scary and they really can be frustrating and a pain. On some level, it seems like the reason why we have nightmares is that our brain and our mind are trying to make sense of our experience, trying to make sense of the trauma, trying to make sense of the difficult things that we've gone through. When we sleep and we dream or have nightmares, we're in a state of REM sleep or rapid eye movement sleep. Our eyes are moving back and forth quickly, and our brain is processing memory. It's trimming and pruning memory and trying to consolidate short-term memory into long-term memory. And it seems to me that one of the reasons why we have nightmares is that our brain is trying to process the trauma. Sometimes our nightmares are directly related to the trauma. The content of the nightmare might have the exact same content as the trauma, and this is pretty common. Though many times our nightmares are symbolically connected to the trauma, that it might not be exactly what happened in real life, but it might be some sort of symbolically connected situation we find ourselves in the nightmare that leaves us feeling in the nightmare the same way we felt in real life. For example, somebody was telling me about a nightmare where they felt like they were stuck in a maze and they couldn't find their way out of this maze, that every direction they tried to go, they felt trapped and stuck and lost. And that was not exactly something they experienced in real life in terms of being stuck in a maze. But when we looked at it closer, they had lots of overwhelming experiences in their life where they felt lost or they felt trapped, that anything they tried to do to get out of that danger didn't work, was ineffective. Every time they tried to get help, it didn't work. Each time they tried to remove themselves from a relationship, it didn't work, and it left them feeling trapped and helpless, just like they felt in the dream, in the nightmare. So it's almost like these nightmares could be a way of our brain trying to represent the feelings or situation to us in a symbolic way for us to try to work through it in a different angle. So although they're painful and difficult and scary and frustrating and disrupt our sleep, we might be able to reconsider that this is just our brain trying to make sense of this overwhelming experience and getting overwhelmed in the process again through the nightmare. And maybe we can try to befriend our brain rather than get upset with ourselves and our brain. So if we're constantly having nightmares and experiencing this sort of hyperarousal from trauma, it can leave us with anxiety about going to sleep, which is just going to kind of snowball into more anxiety and really disrupt our ability to get adequate rest. So if we're having difficulty with sleep, difficulty falling asleep, difficulty staying asleep, it's going to leave us pretty restless. It's going to leave us throughout the day with a sense of fatigue and exhaustion, which is going to impact our memory. It's going to impact our ability to focus and concentrate. I made a whole nother video on that, which I encourage you to check out. It's going to leave us with racing thoughts at night. It might leave us feeling depressed. It might impact our appetite. It could impact our ability to be in relationships and remember things and be fully present throughout our life. Difficulty with sleep really impacts every area of life. For several years, when I was in my bachelor's program in school, I worked overnight shift from midnight to 8:30 in the morning, or sometimes I would work from 8:30 at night to 8:30 in the morning. And until I figured out how to navigate this sleep schedule, I was really struggling with sleep, not getting enough sleep, and it really impacted my ability to function throughout the day. And then because I was working this overnight shift in a treatment center, I was constantly interacting with the patients who were struggling to sleep in the middle of the night. And so I, over the years, developed lots of different tools and strategies to help people try to figure out what worked for them in terms of getting to sleep. And I'm going to go through a couple different coping skills and strategies that can help you sleep in a little bit. First, I want to highlight some of the other ways that sleep can really impact us. When we're not getting enough sleep, it really can break down our immune system. It can have an impact on our nervous system. It can impact our digestive system. It can make us more susceptible to viruses and diseases and illness. It's going to impact our energy. It's going to impact our quality of life. It can leave us feeling really irritable and reactive. And so there's lots of reasons why it's important to address this and to develop good sleep hygiene. So here's some simple things you can try out and see what works for you if you're struggling with sleep. One of the simplest is to develop a consistent sleep routine. To, as best as you can with all the variables in your life and your work situation and family situation, is to get in bed at the same time each night, turn the light off at the same time each night, set the alarm for the same time each morning, and really get your body into a rhythm and a pattern of sleeping and waking around the same time. This is one of the best things that you can do. Our body and our nervous system are really designed for sleep in a consistent rhythm. Another thing that you can do is really try to create a restful sleep environment, that in your bedroom or wherever you're sleeping, really think about the lighting situation, the blinds or drapes on the windows, the sounds, the smells, anything that might impact or disrupt sleep, or anything that might help and increase your ability to get to sleep and to stay asleep. Another helpful, simple thing to consider is how much caffeine and sugar you're taking in throughout the day. Nicotine being another one, or really any stimulant or drugs. Sometimes what could happen is if you're consuming too much sugar or caffeine right before bed, too many stimulants, it's going to impact your ability to get to sleep. So one of the things I learned through trial and error for myself and my own body is that if I have caffeine after 3 p.m., it impacts my ability to get to bed, before or after 11 p.m. at night. So I have an 8-hour window for myself when I consume caffeine, I need 8 hours before I'm likely to be able to fall asleep. And so I really have to be disciplined and diligent about not having caffeine after 3 p.m. Otherwise, I know I'm going to be up later than I want to be, and it's going to disrupt my ability to get enough rest and to function throughout the day. Now, everyone has a different amount of sleep that they need each night. The average person needs 7 to 8 hours of sleep, and actually children and young adults usually need more hours of sleep than adults, because a teenager or young adult's brain is still developing. And so a teen or a young adult may actually need closer to 9 hours of sleep. And it's important to really let them have that sleep, that their brain needs it to develop in a healthy way. So anyways, limiting caffeine, limiting screen time, limiting sugar intake, being thoughtful about what you're eating before bed. Another thing to consider is if you consume a lot of caffeine, sugar, nicotine, or other drugs, that the withdrawal from those drugs, even something as simple as sugar, which is the most addictive drug on the market, the withdrawal from that could be waking you up in the middle of the night. So if you consume a lot of sugar or a lot of caffeine or a lot of nicotine or other drugs throughout the day, and then you're going 8 hours without a cigarette, or 8 hours without sugar, or 8 hours without caffeine while you're sleeping or in bed, what could be happening is that your body is going into withdrawal, and the withdrawal could be waking you up in the middle of the night. And so that would be an indicator to really take a look and examine how much stimulants, how much sugar, caffeine, nicotine you're consuming throughout the day, and to really work on that, on reducing how much you're consuming so that you're not going into withdrawal in the middle of the night. Another simple thing you can do is to really try to wear yourself out and get all your energy out during the day. And exercise is a great way to do this, especially if you're someone who throughout the day, whether you're in school or working or doing something else that does not involve lots of physical movement, like if you're not working in a job that involves lots of moving around and carrying things and picking things up and using your body. If you're like me and you're sitting at a desk or sitting and talking to people most days, then you might want to really take a look at integrating exercise into your day, which is really going to help you sleep better at night. Another simple thing you can do is spend time in the sun. You know the feeling when you're at the beach and you just spent the whole day in the sun, and then you really need a nap halfway through the day and you just feel exhausted? Part of that is because when we're in the sun, our body or skin absorbs melatonin, and melatonin is a chemical that our body processes and helps us feel tired and helps us rest and sleep. And you can actually get melatonin supplements at the grocery store, which can be helpful, a helpful thing that you can take before bed to help yourself sleep. So if you're someone that spends a lot of time indoors, getting out in the sun for a little bit can really help improve the quality of sleep that you get. Other things that can help with sleep, any relaxation techniques, deep breathing, progressive muscle relaxation, guided imagery, calming music, anything that can calm your body down and shut off that sympathetic nervous system. That arousal and reactivity and fight and flight and stress is really going to help you sleep better. And if you're really struggling with sleep and you've tried out a bunch of different strategies, it may be time to seek professional help. There are many sleep specialists and professionals that are much more qualified than myself even, that can really take a look at this from all different angles and help provide professional recommendations and expert advice on helping with sleep. There's medications that can be really useful with sleep. Melatonin we talked about previously, and other supplements can help with sleep. And then other simple things like chamomile tea and hot tea before bed. Just make sure the tea does not have lots of sugar or caffeine in it, but chamomile herbal tea would be a better tea to drink before bed. And then if you've identified that some of your sleep problems are a result of past trauma or traumatic stress symptoms or an anxiety disorder, then it makes sense that if you engage in therapy and heal from the trauma, that your sleep's going to improve. So I really encourage you to consider seeking out a mental health professional, a trauma therapist that can help you work through and heal from that that trauma and the PTSD. So I really hope that this video is useful for anyone struggling with sleep. If you found it helpful, I'd encourage you to write in the comments something that you found helpful. If there's something I forgot to mention that you do that really helps you with sleep, I encourage you to put that in the comments and share that with other people that might be watching this video. You might be able to help someone else with your own experience. And if you wanted to get notified about future videos published on the channel, I'd encourage you to subscribe to our channel here. My hope really is that the videos that I'm creating here are useful for anyone struggling with trauma and any professionals or really anyone that's helping others heal from trauma.